We know that lots of people, when they are diagnosed with adrenal cancer, have questions about why they developed their cancer and what this means for their family members, including their children and their siblings, and want some guidance about how they can share information about their diagnosis with their family members. So meeting with a genetic counselor gives people that opportunity to get some insight on how they can share their diagnosis with their family members, how they can talk about if their family members could be at risk of developing a similar cancer. And then we know for about a little bit less than 10% of the people who are diagnosed with adrenal cancer, they actually have a genetic risk factor that put them at increased risk to develop their cancer that can provide additional information for their family members as well. When patients visit our University of Michigan Endocrine Oncology Clinic, they meet with lots of different specialists. So often it's a very overwhelming time. They're dealing with a new diagnosis, or they're learning that their therapies weren't affecting them the way that they thought. And so there's a lot of information that's happening at that time. So when we meet with those patients who have the opportunity to come through our clinic, what we're doing is we're taking a family history, just taking a step back and asking them questions about their family members, giving them that opportunity to share some of their concerns. And then if there is something that an individual wants to share with their family, either news, information about their cancer diagnosis, or if we uncover a genetic risk factor, we can provide them some guidance, not only about how to broach that conversation with their family members, when and how to tell their children, which is often a very big question, and we can provide written information back to them and back to their physicians, which sometimes make it easier so you don't have to play that telephone game of my genetic counselor told me to tell you. We can give some of that written information to them, which is often very helpful.